Bueno, amigos de Sepa 2026, estamos en el Espacio INTEGRA en colaboración con Perio MX, el doctor Carlos Monteagudo, y el día de hoy me encuentro muy complacido con el profesor Ian Needleman. Ian, thank you so much for being here.
Well, pleasure to be here.
Well, this is an historical moment for paleontology right now because we have this kind of consensus by CDP and Sepa. How important is this consensus reached at Sepa Granada 2026?
Yeah, it's really important. And what the two organizations have done is amazing. People who don't know this kind of process don't realize just how much work goes in behind the scenes beforehand. It's monumental. And even then, afterwards as well, to make sure that everything is reported. So it was a huge effort, and it was, for me, a great privilege and honor to be involved in that. I think one of the most important things for this consensus was that patient-reported outcomes, in other words, what the patient actually says, as opposed to what we think they might say, was right there at the top. And you might think that that's odd, because we've been, in fact, the very first European workshop where we based that on systematic reviews back in 2000, where we did a review on gingival recession. We made a recommendation then that there was very little information about patient outcomes, patient-reported outcomes. So it's taking a long time, but it's wonderful that this new consensus has identified three important things. One is that there's not a lot of evidence, even now, about what the patient really thinks about recession treatment. That's very important to say that loudly. The second thing that the consensus identified was that some of the methods which are being used need a lot of development. They're not really patient-reported outcomes. And then the third important message from this consensus, again, very strong message, is that this must be a core part of future research. We can't carry on as we're doing. So I think it's been really important to highlight those messages.
So with this consensus, we want to share, and we want to know that predictability right now in mucogingival therapy is a reality, because in last decades, maybe in a person that will be a surgery, will do a surgery with a patient, maybe we don't know that we know right now. So predictability, it's a good choice, and CDP and Sepa are leading with your consensus all the world, and the points of view of mucogingival therapy is so important, no?
It's very important, and we've got lots of good clinical evidence about which procedures currently work, and we know, as you say, we know they work well in terms of the measurements as periodontists we think are important. What we don't know, and what I think is a little bit of a struggle at the moment, is particularly in terms of developing new techniques and moving this field even further, perhaps to more complex situations where we're less successful, we don't really know how that fits in with what the patient wants, what they expect, and their overall experience. So we're lacking a crucial bit of, a massive piece of information, particularly, Carlos, since a lot of the time these procedures are done not because there's a disease. Recession is not a disease.
No. Yeah.
It's a condition. But it's something that the patient may ask for. So we need to make sure that we align treatment with those expectations. And at the moment, we've got some way to go to develop that.
I think as a periodontist, that we have right now a great challenge because we are treating periodontitis, periodontal pockets, and the treatment, the surgical treatment of periodontal pockets, uh, the results in a lot of gingival recession and are reduced periodontium and mucogingival condition. So right now, maybe I think that maybe if we know more how to preserve or how to treat mucogingival conditions, maybe we can prevent this kind of sequels that are gingival recessions after the periodontal treatment of the pockets, no? So it's a good challenge for us to what happens after the treatment of surgical treatment of periodontitis?
Yeah, so that's a great question. It's worth just taking a step back and remembering why we are trying to treat pockets.
Yeah.
And the reason we're trying to treat pockets is to keep teeth. And from many people's work, including our own, we know that's one of the most fundamental wishes for patients. What is fantastic in 2026 is just how successful we are in keeping teeth for many, many years. And although replacing teeth may sometimes be required, it's required so much less often. So we're great at saving teeth, particularly as periodontists, I would say. And of course that also has benefits for general health as well, as we know, but that's a different subject. If you're saying the question, is that enough to save teeth when we create all this recession? Well, we have to ask the patients, because for many of those patients, the answer is very satisfied, very happy if you can save my teeth. But undoubtedly, we would like ways of saving teeth where we also saved or regained some of the soft and hard tissues. I think some of that may come from the perioplastic research. And I think one of the links between the perioplastic research and periodontitis surgery is that it's made us all think about our surgical technique.
Yeah.
It's made it in research, but also just in our practices. How can I somehow bring these techniques? And with doing that, that has achieved some benefit in not losing so much tissue. But we also need to bring into that a completely different area, which of course is a huge interest as we see around this conference, in the posters, at any conference. True regeneration, rebuilding hard tissues, rebuilding soft connective tissues as well. There's a long way to go in that.
So in the EFP guide recommendations, clinical recommendations to treatment of periodontitis, we have the different types and the recommendation of orthodontics. So in this consensus, you can recognize to the mucogingival conditions, we can take our ortho, that is an important tool to preserve or to get better in a mucogingival thing after or before the treatment?
Yes, I think you're absolutely right to bring that in. And I think at the moment, we don't have strong enough, perhaps, communication with our patients about that. Because if you ask a patient, do you want to undergo orthodontics? The answer is almost certainly going to be no. But if you explain properly what the benefits, the long-term benefits can be, then it may still be a no, but at least people have thought it through. So again, it's an area in terms of research. We need to think about research which looks at methods of communication and what patients really want. I think about 2-3 years back, we did something similar with implant outcomes. And what was fascinating about that process, we involved patients from 4 different countries, low, middle income, as well as high income countries. And at the end of that process, we had an entirely new outcome, which none of us professionals had thought about, but the patients from around the world felt was important. And we need to understand that's likely to happen with periodontitis and with recession. So we need to involve patients in a more formal and fundamental way.
So thank you so much for the time. So last question. What advantage do you see the collaboration between Sepa and CDP? It's a great collaboration. I think that you can reach a lot in global scale. So what advantage you see, and what's your opinion about this fraternity and friendly engagement?
Well, I think you've hit the nail on the head. I think that these collaborations, when they are with a good heart and sincerity, can be very productive. And certainly the experience I had in Florence, was it last year, the effort and the sincerity and the will to achieve something special was very strong. Now, of course, I'm somebody like most of the people in Sepa and the Italian society that are never satisfied. We always want to do more. That's the nature of being a periodontist, I think, as well. That's one of our character defects. And I think what's really going to be crucial for this kind of collaboration to move on to grow and develop is involving patients directly in that collaboration, because we've done it in the UK, we've done it to some extent at Perio. It works really well, and we all learn a lot from each other. So that, I think, will be an important part of the next stage of development. But congratulations to both organizations for a fantastic initiative and development.
So thank you so much for your time again. So thank you. Y seguimos aquí en el Espacio INTEGRA. Gracias al doctor Ian Needleman. Thank you so much for your time.
Carlos, thank you very much.
Gracias.